Rheumatic fever, the consequence that we're trying to prevent, rheumatic heart disease will have somebody dying 20 or 25 years earlier than they need to. And they will have had multiple cardiac operations, so there's a huge cost to society. The lost life years, the lost income, the effect on that family, the effect on our community.
If we had sore throats checked back then when I was little, in every school everyone had to check their throats, I reckon I wouldn't have rheumatic fever.
We never know what's rheumatic fever until they explain to us.
My name is Melesiu and I'm 17 years old. I am Tongan, full Tongan. If your child has a sore throat, you got to take them to the doctors. You can't just shake it off like, oh, it's going to be fine the next morning. But really, it's a really big deal because, sore throats can lead to rheumatic fever can lead to heart disease, or more, like worse than that. We've got to get a whole lot of moving parts. It's not just, there's no one single king hit in this. There's a whole lot of moving parts we've got to get going on that. Part of it is about community understanding of rheumatic fever. Part of it is understanding that it's sore throats that we need to intervene at. The sound is no longer around where the kids who brought the music back. The time is now or never to make a change for the better. The sound is no longer around where the kids who brought the music back to town. The sound is no longer around where the kids who brought good music back to town. The sound is no longer around because we're the kids who brought the music back to town.
Thank you, everybody. We're the Rheumatic Fever tent. Please come and get some info. It could save your life one day. It could. If you've got a sore throat, please go and see the doctor. Don't box it and try and be Superman. Because you're not Superman.
And if you are feeling a sore throat and you don't know if it's worrying or not, you can call free phones 0800 611 116 and get it checked out, man.
What number was that again, Gibby?
That number, Tony, was 0800 611 116.
Previously we'd go, look, have some paracetamol, get over it, it's okay, it's likely viral, just go to school and all the rest of it. Now we're saying, take sore throat seriously, get to clinic, get it swabbed. If it's group A strep, get it treated, 10 days, make sure you take the whole lot. Actually an enormous amount of work, and we have to do that consistently. Not once, we have to do it every time they get a sore throat during the year. We have to do it not just for 1 year, we have to do it for multiple years.
Here we go, well done.
I would far rather we got better at preventing this problem than becoming experts at treating the complications of it. You were in hospital for quite a long time when you had rheumatic fever. I remember when we came and saw you. How long were you in hospital for?
I think 9 weeks or something.
9 weeks. Was that hard?
Yeah.
Yeah.
I just wanted to go home.
So we've got hundreds of GPs, and we've got practice nurses, and we've got all of this health practitioner capacity, and we've got to shift that to doing the right time, the right thing, the right time, every time.
They're pretty good up here now, like they've advanced a lot to when he first was diagnosed. Like now they have the moko team in the school, so he can just go there when soon as he gets a sore throat. It's like getting him to self-manage it now.
I reckon it's just like the way we live affects. I think that's why I got sick.
We got like 2 bedrooms in the house and 4 girls in 1 bedroom, me and my husband in the other bedroom, and the boys in the lounge.
We had a tight house with there was like 6 kids.
I think that overcrowded affected that's why Melesiu got rheumatic fever as well.
That's a bit worry for us, so we were trying very hard to get a bigger house, trying to get all those letters from doctors and specialists, so we get like a strong point for the housing, so we can move to find us a bigger house. But once we move here, we find it very easy for our family. And now
this program is designed to is going all out to try and make a difference to the lives of people, mainly about the well-being of children in terms of preventing reoccurrence or having children susceptible to rheumatic fever. The cold air still comes through because it's really not closing properly. So I
think we've got a program that is working, and the evidence that it's working is around the reduction in rheumatic fever in the age group and the populations that we're serving, and the reduction in skin infection admissions to hospital.
I'm seeing it working on a daily basis here in Kaitaia, both in the community of children in the schools that we're working in, and also in the clinic, where we're seeing people coming in and saying, hey look, my child's got a sore throat, I think they need a throat swab, I want to check for a strep throat. Kids saying, hey, I need a throat swab. You know, they're telling their parents this. So I think the message is getting out there.
Well, research is very important because we don't know the answers. So primary prevention, for example, it has been successful in Cuba, in the Caribbean, even in the United States of America. But the components of it, was it the sore throat swabbing? Was it the public awareness? Was it better? Were the health professionals more aware of rheumatic fever? The individual components of that is very hard to tease out. And I think New Zealand's taken the bold step of just implementing a primary prevention program.
Because I have rheumatic fever, I have to take injections every 28 days so I can have a healthy heart.
she's taking like one each month.
Like I keep up to date with my injections because I don't want to get a surgery. Because I still want to wear dresses, you know. I don't want to wear a dress with a scar.